weird. I have to use my phone instead of fiber optics. All right. Let me jump into the. Let me share my screen. All right, you guys can see it?
Yes.
So I've got both on here. So like, I've got this is all the stuff from lymphatic and immunity, but we'll start here first. This is about halfway through, and we'll just look at these. And so, yeah, this is the first the first question that I might ask, just to explain the regions of the pharynx, because people do use these regions. They do talk about them. So if you could just kind of know where they are. The oropharynx is kind of telling you that, it's going from the soft palate to the very beginning of the laryngopharynx, the hyoid bone, right? So everything above that would be nasal, and everything below that would be laryngopharynx. So that's a possible question here, this slide, and that's really more of an anatomy thing. The layers of the trachea could be another possible question. I would study these two last. Like when you're looking at the questions from the respiratory chapter, I would go to the end maybe, because physiology. I'll tend to ask more questions on physiology than anatomy, right? And this is kind of an anatomy question, right? So it's not how something works, and neither is that one. That's not how something works, right? Anyway, this could be a second one. The 4 layers, right there. Just kind of how it's written out. And so that's going from the most inner layer. The mucosa is the lining of the trachea, right? And you'd know that anyway, because this is an epithelial tissue, and so epithelial tissue is always the lining of something. And then you're going from inside to out. I'm not sure why I left this one. I just didn't want to erase it. Not sure why I left this one, but I would like you to know that, I don't know how I'm gonna ask it if I do, but this would be a possible question. And really the important one is the type 2 cells, and the fact that these type 2 or septal cells produce surfactant. And then, of course, I'd want you to know what surfactant does. The fact that it lowers the surface tension of the fluid. So the idea that the alveolar walls are moist. They have some water there, but the air has to get past that water, so you have to lower the surface tension. Water has a high surface tension. If you've ever belly flopped into a swimming pool, that's surface tension. Let me see if I've got another. All right, I might combine it with this question. So that would be, if I do it, I'll probably combine it. I'll say something like, what is the respiratory membrane made of? And what are type 2 alveolar cells, or what's the respiratory membrane made of, and what are septal cells? Something like that. All right, so I'll put these both into one question, I think. So this is just the this is just right here. This squamous tissue, the epithelial tissue of the alveolus, the basement membrane that it's attached to, the basement membrane of the capillary, and the endothelial cells of the capillary. That's all I put there. Just got, two basement membranes attached to each other. And then on top of that, epithelial cells, and below that, epithelial cells. It's just two epithelial cells, two basement membranes. So I think it's, I got it over here. So that would be like question 3, right? Question 3, we're combining. Question 3, we're combining that and that. And then this would be question 4. What are the laws? You could write it out like this. I mean, however you want to write it out, but it's pretty much this slide. If you don't want to remember like inverse relationship, and you want to say as like as volume goes up, the pressure goes down, vice versa. I mean, you're essentially explaining it. Dalton's law, what we're really talking about here is the fact that oxygen and carbon dioxide aren't dependent or aren't related to each other. So as the pressure of oxygen goes up or down, that has no bearing on the pressure of carbon dioxide. They have their own pressure that they give. Henry's law might be the most difficult to write out, but we're talking about gas dissolving in a liquid. We're talking about oxygen dissolving in blood. And the amount of oxygen that dissolves in blood depends on the pressure of the oxygen and how soluble the blood is. And which one of these laws apply here? So here we're talking about breathing in, and I'm talking about the diaphragm and the intercostals. Which one of these 3 laws is the one that's applicable to the whole thing about inhalation? So we can go to, and it's okay, I'm just going to tell you, Barry.
Henry's, I guess.
So, well, no, I was going to say we can get rid of this one, because here we're talking about gas, oxygen dissolving in blood. So that's not breathing in. It's right up here. Inverse relationship between volume and pressure. So this is all Boyle's law. Because your diaphragm's going down, and right here, contracted diaphragm increases pulmonary, actually look, it tells you right here. Contracted diaphragm increases pulmonary volume, which decreases pressure. So as the diaphragm contracts and it goes down, the lungs get larger, bigger volume, and therefore pressure goes down. See? Inverse relationship between volume and pressure. As one goes up, the other goes down. So the lungs are getting larger, the volume's getting larger, pressure's going down. The external intercostals also make the lung volume larger. It's like lifting the rib cage. It's like the handle on the bucket. It's that type of thing. So that also contributes. So both of these things, the diaphragm and the external intercostals, contribute to an increased lung volume. And that's going to decrease the pressure. And that makes you breathe in. Because when the pressure goes down in your lungs, it goes down to a point that's lower than the air around us, this ambient air. So that air is going into your lungs. Not so much that you're sucking it in, it's more of a thing that your lungs get larger, the pressure goes down, and then the pressure from outside in this air wants to go in your lungs. And I think this slide is explaining it. I just never followed it through. So intercostals contract. Let's know this is kind of thoracic cavity increases in size and volume of lungs expand. Then they're giving numbers. I don't care about the numbers, but they're just telling you that the pressure in your lungs decreased to 758, but the atmospheric pressure is 760. I don't know how useful this slide is. It might tempted just to erase it because it might mess you up. How do you breathe out? I should have put that. I'm going to. Well, I'm going to do it really quick.
Diaphragm relaxes.
Elastic recoil. So yeah, the diaphragm will relax, and that's true. But the most of breathing out is just the lungs have an elasticity to them. They have lots of elastic fibers associated with them, and so they just kind of want to go back and stretch back to and recoil back to how they were. So it's elastic recoil. There are, and then I'm just going to put here that is passive. There are some muscles that can make you breathe out. There are your internal intercostals. And that's active, so that's not normal. This is like if you're making yourself breathe out. And then there's some abdominals. There's a couple other muscles too. All right. So that's what makes you breathe out. The main thing that makes you breathe out is elastic recoil. And I hope when you look at this, you don't see active as meaning that it's like an actively thing going on. No, active means that it needs energy. So somebody could look at this slide and say, and it looks confusing because it's like, well, elastic recoil, passive. All right, well, that's not an important one. These two are the important ones. No, it's not. I'm just mean elastic recoil is passive. It doesn't use any energy. It just happens. It's just like automatic. You don't need ATP. You don't need to contract any muscle or anything. It just happens. The second two, if people are using the internal intercostals or the abdominals, then that's a bad sign. You know, maybe if they've been like jogging and stuff, okay, they're going to use those, right? But if someone's just sitting around and they're using their abdominals to breathe out, then no, that shouldn't be happening. Breathing out should not be active. Breathing out should just be passive. So, so you've got breathing in, and you have breathing out. Really breathing out. If I were to ask you about something like breathing out, I mean, I think elastic recoil would be a sufficient answer. I want you to know what tidal volume is, for sure. So what is, like, what would be a definition of tidal volume, and then what's the number? Usually I'm not big on numbers, I don't care, but I'd like you to know this number. So yeah, so tidal volume is a normal breath. The normal breath in and out. It's like a normal tide. So air comes in, air goes out. 500 milliliters. Then what's inspiratory reserve? That's how much more can you get into your lungs after a normal breath. Expiratory reserve, how much more you could push out of your lungs after a normal breath. So just you breathe out normally, now push everything else out. And the reason, of course, why this is larger, you could get in 3,100 milliliters, but you can't breathe out everything. You know, so you need some, your lung will collapse. Your body's not going to allow you to do that. So it's all, your lungs are always going to leave some residual air inside there, right? But anyway, I won't mess with any of these over here. So we've just got three, right? Tidal, inspiratory reserve, expiratory reserve. You can take these like as people breathe, like you see it's like going up and down. If this curve shifts to the right or the left, it tells you different things about what kind of different diseases they would have. Because if you, like, think of the elastic recoil and think of the lungs as like a rubber band. You can make that rubber band looser, or you could do the opposite and you can make it really tight, right? Like if you can't get air past the lungs because the lungs have, like, let's say they're sclerotized, then what's happening is that it's hard to push that air past, and the lungs are like going slow. It's like a really strong or rubber band, and so it's making it to for the lungs to expand takes like a lot of energy. And so this upper curve here, you'll see it, instead of going up, it's going to curve that. Should go that way. Instead of going up, it's going to curve that way, right? But then when you're coming down, it's going to come down quick. So if you're looking at like the exhalation part, it comes like, it's not a hill. It's like a hill where one side is really see, I wish I could just draw this on the board. You know what? Never mind. This is not important for the test. I got to stop doing these things. I can't draw it out, so just trying to tell you this could mean something later on. So expiratory reserve, tidal volume, inspiratory reserve. Minute ventilation. That's just tidal volume times how many breaths a minute. And you breathe somewhere between 12 and 20 times a minute. And then I'd like you to know that 70% of that reaches the respiratory zone. Meaning 70% of what you're breathing in, of the oxygen that you're breathing in, is going to make it to the capillaries, to your blood. And the rest of it is we call it anatomic dead space. So if I were to say, if I don't know if I'll do it. Well, yeah, why not? If I say, look, I'll be like this. I could say, what is tidal volume, and how much of that reaches the capillaries? Like what's the alveolar volume? You know, you just take 70% of 500. And then all you'd really do is just say 7 times 5. And that'd give you 35, and then put your 0 back there. So 70% of 500 would be like 350. Oh, maybe I won't do that. You know what? Scratch it. Because you're nervous. You're going to be nervous taking a test anyway, and then I'm going to like do math. That's not fair to all of you. Although I would say that you should, in your head, you should be able to do it like super quick. But I know it messes people up. Just know it's the alveolar ventilation rate is about 70% of the minute ventilation, meaning how much of that air actually reaches far enough down where it could go into your blood. This one, I'm going to ask you a question like, explain the partial, or I'll say something like, what are the partial pressures of oxygen and carbon dioxide in both the oxygenated and deoxygenated blood? So let me put it another way. In oxygenated blood, what's the pressure of oxygen? What's the pressure of carbon dioxide? And then in deoxygenated blood, what's the pressure of oxygen? What's the pressure of carbon dioxide? And they're actually here. Pressure of oxygen in oxygenated blood is 40. Pressure of oxygen in deoxygenated blood, pressure of oxygen in oxygenated blood is 100. In deoxygenated blood, the pressure of oxygen is 40. In deoxygenated blood, the pressure of carbon dioxide is 45. In oxygenated blood, pressure of carbon dioxide is 40. This is starting to get to Henry's law. So it's the amount of oxygen that will dissolve in I mean, we haven't really gotten to it yet here, but the amount of oxygen that will dissolve in a liquid is proportionate to the pressure of the gas. So we're saying that the amount of oxygen that will dissolve in blood is dependent on the partial pressure of the gas. Because really, if we're talking about oxygen, we don't care about the pressure of carbon dioxide. We don't care about the pressure of nitrogen that's in this air. This air is 78% nitrogen. We don't care about its pressure. That's why I have up here partial pressure. And that's what like in the book, you'll see this P is like even larger. So it'll be like a big P and then O2, meaning the pressure of oxygen by itself. So depends on the pressure of the gas. So that's why, we were talking about at the beginning of the lecture, when you're up really high, the partial pressure of oxygen goes down. Doesn't mean the amount of oxygen goes down. It's still, that oxygen's still in the air. It's just it's not as pressurized as you go higher in elevation. So, and then, of course, this is a rate of gas exchange, but so the surface area available is important too. That's not part of Henry's law. That's just a factor in gas exchange. But as far as Henry's law, the pressure of the gas is important, and how soluble the liquid. And in this case, by liquid, we mean blood. How soluble is the blood? And then let's go further. Because what is it that oxygen is trying to go to when it goes in blood? The hemoglobin. So within the blood, it's going to the hemoglobin. So how soluble is the hemoglobin? So that's what this slide is. It's saying, what are some factors that make the hemoglobin or blood more soluble or less soluble? And so I use the word affinity. So what makes hemoglobin, what increases or decreases the affinity of hemoglobin for oxygen? What makes hemoglobin want to hold on to oxygen or not, or want to let it go? Right, and so that's one of the questions, this slide. And so I would want you to know, what do you mean pH? What do you mean increased CO2? Like why? What about heat? Does lower heat do anything? Is it higher heat? So the hardest one might be down here, biphosphoglycerate. You don't have to, by the way, you don't have to learn the word biphosphoglycerate. That's fine. Hold on, let me let somebody in. So those are the 4 factors. How does carbon dioxide get around your body? Look, guys, you don't need to memorize this thing. Most carbon dioxide is transported as bicarbonate ions. That's okay. You could just put that. So you don't have to sit here and try to is it HCO -3, or does the 3 go first? Don't worry about it. I put this here. I want you to recognize it. So if you saw it one day, you would know. Why can't I go back? Oh, I want to hear these questions. Good morning to you too. What are your questions? Or do you want me to wait? All right. You got me all excited. All right, we'll get back to you then. So, I want you to know that most of it is transported in the plasma as a bicarbonate ion, and you could just write bicarbonate ion instead of this thing. You don't need this thing at the bottom. Some of it, and you don't need to know how much exactly. So 23% or whatever. I'm not even sure that's exact, but you don't need that. Just some of it is transported on amino acids. It grabs onto the amino group of amino acids, like hemoglobin, for example, because hemoglobin is a protein. It's an amino acid, right? So, and then a little bit of it is dissolved in blood plasma. So some of it's dissolved in blood plasma. Some of it rides on amino acids that are in your blood. Most of it forms bicarbonate ions. I don't have one for how is oxygen transported, but it's a very easy answer. Hemoglobin. More than 98% of oxygen uses hemoglobin. So we've got 1, 2, 3. Here I might just ask you something like, why is the air, like, quote, air thin in mountains? Here, just ask you something like that. An easy answer if you know. Don't put less oxygen. The pressure of oxygen. So 1, 2, 3, 4. What's the partial pressure of oxygen in oxygenated blood? What's the partial pressure of oxygen in deoxygenated blood? And then the same thing for carbon dioxide. So that's 4. Question 4. 5. I got 5 questions. 6. I'm going to put these two together if I do it. So 6. Question 6. Question 7. Question 8, which I'm putting these two together. 26 and 28. So that's question 8. Nine, 10. All right, so there's 10 questions that I'll possibly pull from these. I'm going to take. I'll take 7, maybe 7 questions, possibly 8, but 7. I'll take like 7 of these questions. I might not even take either of these first 2, but I'm going to take 7 of these questions, and then I'll take maybe 3 or 4 of these other ones. And this one's from before. I mean, I won't. There's a whole video on it, and there's slides on it. But all I did was I took the slides from the Quiz 3 study guide and I stuck them here. Right. So this is the same thing. So, and you ask yourself, if I did not ask about it on the exam, then maybe I'll ask about it. I mean, on the quiz, then maybe I'll ask about it on the exam. But we definitely did this one, functions of the lymphatic system. That was on the quiz. I didn't talk about any of this. I don't think I'm going to be able to get a question. Oh yeah, I did. This was one of the questions. This one was the last question. I won't ask you anything. I'm not going to ask you this slide. That's not really a good question that I can ask. I don't like this question either. I should start erasing some of this. I might ask this again if I didn't ask it before. And I can't remember if I did, but that's definitely up for grabs.
You did.
I did. I might do it again.
You didn't ask antibody-mediated immunity.
I might do that. Actually, that's so this is up for grabs. This one, definitely another one. Man, I'm really tempted to revisit this one, but this is another possible one. Second line of defense. Explain. Oh, let me just tell you something so you don't get. So you have natural killer cells, right? And that's here, and here we're talking about the second line of defense. So we're talking about general immunity, not specific immunity. We're talking about general immunity. And so natural killer cells are cells that are part of your general immunity. And they use perforin and they use granzymes. Over here towards the end, here we're talking about cytotoxic T cells. which are different. They're sort of different from natural killer cells. They're the same in what they do, and they're weapons, but they're different in that cytotoxic T cells. That's for a specific immune response or an adaptive immune response. Natural killer cells are just for general immunity. Cytotoxic T cells are for a specific immunity. But they both use perforin and they both use granzymes. And so I already see a mistake that I had made up here, which is why you guys weren't. Now I see. So and I didn't mark you wrong for this, but like a lot of you didn't write T8 cells. I was wondering why, and it's my fault. There. But it's okay. I didn't care anyway. Like it wasn't something that I took points off for. That's a little thing, right? But the T8 cells are the ones that are going to become the T8 cells are going to clone and make a massive clone army of cytotoxic T cells. So that's the cell mediated. And if we go to antibody mediated B cells, so not T8 cells, but now we're talking about B cells, they clone to a massive army of plasma cells. And the plasma cells, in turn, are secreting thousands each of antibodies. I made things confusing. So again, cell-mediated, that's a question. Just like the quiz. I don't think I've changed anything. Antibody-mediated. I might ask that one instead, since I didn't ask it on the quiz. Functions of antibodies again. And this time, for most of you, try to make it more organized. Don't be like me when I'm saying the functions of antibodies. Oh, I don't know. It like brings them together, and then I can't forget the other one. I can't remember the other ones. I forgot. No, it's these are pretty much what antibodies do. I essentially took this out of the book. You'll find a list in your book as well towards the end of that chapter. Right. So understand what they're doing and kind of organize it better. And I don't blame you for not organizing it in the quiz because I wasn't organizing it during a lecture. So you didn't have a lot to go on. Okay.
Now, on the function of the antibodies, it has to neutralize the antigen first. Is that like an order? You know what I'm saying?
No, right. There's no order.
No? Okay.
No, you could say you could start with agglutinizing antigens and then neutralizing antigens would be next, and it's okay.
All
right. So let me do a count here. 1, 2, question 3. Question. All right, 4. This is all part of question 4. 4, 4, 4, 4. Question 4. Question 5. 6. Uh, 6. Those 6 questions. 1, 2, 3, 3, 3. I'm skipping a lot. 4, 5, 6. We had 8 questions from the respiratory, 6 questions from immunity. And really, I mean, that's essentially the quiz, isn't it? So you can just go back to the last lecture and you could see the test because I went over the questions on Monday. I went over the questions. All right, so so what did I say? 14 questions, and then I'll pick 10 or 11, probably 10. So I would study. I would definitely, spend your time studying studying respiratory system, and then I would do that first. Does anyone have any questions on anything? Yes. Processes oxygen and CO2. You mean, what does it do with it once it gets it? Or how does it get it from the air inside and get it, like, how does it transport it around? Well, I answer both. It's first is diffusion. Everything moves by diffusion. Higher pressure to lower pressure. That's it. That's how things get around our body. You don't have to make oxygen get to our cells. It will go to your cells. The pressure is higher in the atmosphere, therefore the oxygen goes into our lungs. The pressure now is higher in the blood, so therefore the oxygen just moves into the blood. Then when it gets to the cell, the oxygen's higher in the cell than in the blood than the cell, so the oxygen moves to the cell. Carbon dioxide is doing the opposite. It's going in the opposite direction, but for the same reason, for higher pressure to lower pressure. Yeah, that's how the respiratory system. That's how it moves it. That's how it moves it around. As far as like on a cellular level, I don't think you mean that, so I'll skip that one. Upper rest, yeah, and I won't ask you on the test, but the upper respiratory is here, neck, like if you could see it, like if a doctor can go stick something in your mouth and like even like look way down there and see it, then you could say it's like upper respiratory. Lower respiratory is going to be lungs. So an upper respiratory infection is like when you're it could be like when your kids have a cold and or like a sinus infection that it's like the sinus infection is draining to the back of your throat, that type of thing. That's upper respiratory. Lower respiratory is lungs, and so you're going to hear it in the lungs. Like you can't diagnose it without listening to the lungs. And even within your lungs, you always notice that a doctor will stick the stethoscope like up high and then also down. So it'll be like here, 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 and the same thing in the back. Back's a better place to listen anyway. There's actually lower fields and upper fields, and depending on where you hear the sounds. So if I hear a sound at the lower fields, like in the lower part of the lungs, and it'll sound like not like crackling, but it sounds like there's water down there. Like it sounds like you would think if there was water down in the lungs, then then you're thinking something like pneumonia, right? But if you hear it and you hear like wheezing, and you might not hear that in the lower, but you might hear those in the upper fields, right? Well, then you'll be like, oh, well, it's not like a pneumonia. It's like some kind of constriction, maybe some kind of allergy or something, asthma, something like that. I'm getting off this subject. I'm not going to ask you about upper and lower respiratory tract on the test.
I usually think of larynx as being the division for upper and lower. And
What's that?
I usually think of the larynx as being the division from upper and lower.
Yeah. That you're right.
And then the upper is the bronchitis, and then lower is more pneumonia. That's kind of how I think of it,
Yeah, it's a good way to. Yeah, you're right. Oh, it's on there. All the structures. No. All right. So yeah. Yeah, you don't have to memorize. There is a slide on there that says like lungs and primary or trachea, primary, secondary, tertiary, bronchus, bronchioles. It's okay. You can leave it out. I think we're good then. So, yeah, any other questions? Let me stop recording.
Are you gonna
Yeah.